Hi, I'm Dr. Roadhouse with Roadhouse Chiropractic. If you're in Tulsa, we're located at 65th and Yale in the Kelly Medical Building on campus at St. Francis Hospital. So anyway, we had some technical difficulty with the signal today, so we're just going to shoot this video and we're going to upload it so you're seeing the video and it wasn't on earlier. But anyway, we're going to talk about common sports injuries. If you have any questions, you can email them at Ask Dr. B Show on Gmail. So anyway, whatever activity you're involved in, whether it's skiing, tennis, baseball, hockey, karate, ballet, dance, anything like that, there's going to be characteristic injuries. Some are going to be from overuse syndromes, and some of them, just because of the way that you move, are going to cause some injuries. Several years ago, I was on the medical staff for the Junior Olympics when the Taekwondo was in Tulsa. And, Taekwondo people, obviously, depending on what division you're in, as you get older and they're more aggressive and they're black belts and red belt black starts fighting them, you're going to kick the head, you can get neck pain. They have a lot of problems with wrist because of the punching and breaking boards. A lot of problems with their lower back and knee, the twisting type of misalignments. And then also from the repetitive kicking, the different kicks, they practice them so many times and they use a lot of momentum when they're doing that and can stretch the ligaments, and then with the twisting motion they do, then they can misalign. So every sport is going to have some characteristic injuries. So when the patient comes in, we have to find out what are their activities. And then try to figure out, what's going on with them. Some of them are going to have to rehab them muscle-wise. Some of them we might have to use ART, which is, where we work with the muscles because they're staying a tightened position. And then, obviously, if they need adjustments, if they need therapy, if they need bracings or taping, we do the K-tape, which is a functional taping. So all those things come into play. So every sports team that is professional in the major leagues, from NBA, NHL, NFL, any of the sports, tennis, they all have chiropractors that take care of them. And it's a team approach where everyone is on the team because they're working together, and whatever I do, the other doctors respect what they do. I respect, and we work together with one common goal to get the patient back into the game as quick as possible, where they can still have, good contribution to their team. There's a time we have to make a decision like, nah, this is too much, and you're not going to be able to be competitive, or you could cause further injury, so we're going to have to take some time off. But most of the time, we can keep the patient in the game, and that's our ultimate goal. And if we can't, we try to get them back as quick as possible. So I guess, one of the common injuries is going to be a shoulder problem. And, there's a lot to be, if you talk to people about shoulder injuries, the first thing that's going to come up is they're going to talk about the rotator cuff. Because anytime you have a problem with the shoulder, first thing people assume is going to be rotator cuff. Well, rotator cuff, if you have a problem with the rotator cuff, whether the tendons are just starting to get shred or if there's a complete tear, you're not going to be able to go in this motion right here. So the humerus and the scapula, the way that they misalign, there's 8 different combinations. So if you can go like this, then you don't have rotator cuff. You may be diagnosed with rotator cuff, but it might in fact not be rotator cuff. And a lot of times, poor rotator cuff gets blamed on a lot of things, just like if you think about, 20 years ago when you had a back problem or a hip problem or something like that, they just blamed it on arthritis, when a lot of times, we take an x-ray and we don't see any signs of arthritis. So rotator cuff, there can be a lot of different problems with the shoulder. Like some patients come in, they go, well, I can't go all the way across like this and I can go this way. Or I can go up like this, but on this side I can't. Or I can't reach back here. Those all give us a clue as to which way the shoulder has misaligned. How does this happen? Well, if you're in a sport where you get contact and you get hit like this, you land on the ground, sooner or later it's going to stretch the ligaments, or it could be a one-time event, so it could come on over a series of events, or it can come on one time, a perfect hit that hits you in a way. and it causes injury right then. You've seen in the football field, where they get hit and then they're like this and they have to go off, or they have to come out and help them off the field. So there's different ways to get the injury. Like I know I take care of a lot of weightlifters, and when you're doing anything out to the side or up above, anything like this, or going straight up, that does put a strain on there, and you're always trying to increase your weight, try to get more reps. But a lot of times it's just getting it off the rack, or if you're not using a rack, you need to have someone spot you if you're using a rack, because a lot of times we're back like this, you got to lift it up, pull it like that, and then do the exercise, and then you got to put it back when you're fatigued. That can cause problems. The other thing is, if you're doing a lot of dumbbell work, just when you get up to a certain weight and you're sitting on the incline, you're doing presses, and you pop it up, you have to use momentum to get it up if you're using a heavy enough weight, and sometimes it over rotates. Well, that's going to misalign the shoulder. A lot of lifters end up having a shoulder problem, so then they go and do different exercises, and you're moving that joint. As you move the joint, if there's a misalignment, it's going to start inflaming, and it's going to start giving you some discomfort. So shoulder injuries, you have to get evaluated, and you have to find out exactly what's going on with the patient. Sometimes it's just a strain in the muscle. Sometimes it's actually a ligament. As you might remember from high school, if you took any classes, there's grade 1 means a little stretching, grade 2 maybe stretching, but maybe some microscopic tearing, and there's grade 3 on the ligament, which is a complete tear. That has to be surgically repaired, whether it's a tendon or a ligament. So those have pretty good signs. I mean, usually when the patient comes in, you can have a pretty good idea. And the best way to evaluate that is to do an MRI on that, because x-rays, you can kind of see where the bones should be, and if if there's too much gap in the bones, you can presume that maybe there's an injury to the ligament. But if you do an MRI, you're going to know for sure. So before you go and do anything drastic, you want to make sure you have the joint properly evaluated. And sometimes it can be as simple as there's two little muscles in the back here that help hold the arm bone in place. And so a lot of times when you're doing exercises, you're working on the front part, and you really don't work on any of the back part of it, of the muscle, or on the shoulders. And so because of that, you can get a muscular imbalance. And so what that means is then it can give way to the joint not being able to be stabilized, because the ligaments help hold the bones in place, but the muscles around there, they're the ones that are the second line of defense. And so what happens is, especially with the lifters, is they'll be doing several sets with these dumbbells. Muscles start to get fatigued, and mentally they're getting fatigued, and then they kick the dumbbell up one at a time, and they have that split second of lack of concentration, the muscle's weak, and then over rotates and goes too far. So anyway, on those patients, we got to do a good history on them, we got to do a good exam, then we got to do the proper diagnostics. And the thing is, I'm over here at St. Francis at the Kelly Medical Building. There's all kinds of doctors here. So if it's something that isn't something that I can take care of, I'm going to figure it out for the patient. We'll do the diagnostics, and then we'll make the appropriate referral. Some of them it's a complete referral. Some of it's a referral where we work together, so that like we do on the sports team, so that the patient can get the best resolution to their problem. So shoulders, depending on what the pain pattern is, we have a pretty good idea as to what's going on. I know one time I took care of this pitcher, and he was a pitcher for SMU, and he had like a 94, 96 mile an hour fastball, and he lived here in Tulsa, and so anyway, all of a sudden his fastball is like 70, 80 miles an hour, and they couldn't figure out what was going on with him, and so he'd done some physical therapy, been an orthopedic doctor, and what we found out that his scapula was misaligned. It doesn't seem like a big deal, but in someone that's throwing the ball 94, 96 miles an hour, everything has to be working right. And so when your arm bone goes back like this, if everything's not working right, you may not go all the way. You might change your form. You might have to, instead of throwing like this, you might be moving like this. So you're gonna, and especially a finely tuned athlete, they're gonna adapt to the situation, and they're gonna get that ball across the plate as best as they can by adapting to it. And that's where you'll see like all of a sudden their speed is off or their control is off. And so anyway, we checked the patient out, and they had a problem with the fibula, and they also had a problem with their ulna. And so we adjusted them, and then they had a resolution to that problem too. So you just have to look at each patient. So the shoulder, I mean, you don't realize it, but when you have a shoulder problem, it affects you when you're sleeping, because if it hurts, just lying on it like that. When you're sitting there and all of a sudden you reach for something, you're like, oh my gosh, so it really affects you. You don't realize how much you use your shoulder until you have something like that. And I was the team chiropractor for the Tulsa zone, and one of the reasons that I became the team chiropractor is because they had a couple of players there that were having problems with their lower back and had some sprained ankles. And so with the sprained ankle, in basketball, someone goes up for a rebound, they come down, they land on someone's foot and they twist it like that, or they go up for a shot and they come down. A rolled ankle is real common. So, with those type of patients, sometimes it just goes right back in, and sometimes it swells up and it's big like this, and they kind of hard putting pressure on it, it's black and blue. So in those patients, we have to obviously ice it. We want to get some therapy on there. The best therapy for that is interferential rather than electrical muscle stim or galvanic or TENS unit. You want to use interferential because it speeds up the healing process and helps get rid of the swelling. Then you want to, obviously do the diagnostics to make sure there's no avulsion fractures, any broken bones or anything like that. Then you want to adjust the patient. Then we want to use KT tape. And sometimes when that happens, they'll get an upper ankle sprain, and that's where we use the muscle work, the ART, to help them. You can have a upper ankle sprain, and that can last for a long time. But if you work on the muscle, a lot of times you get results relatively quickly. So a sprained ankle is real common. A lot of people just say, oh, I've got a sprained ankle. If it's real bad, they can't do anything for 6 to 8 weeks. With what we do, we try to get them back as quick as possible. And a lot of times we can do that in 2 to 3 weeks instead of the 4 to 6 weeks. And obviously that depends if it's a grade 1, grade 2, grade 3. But I'm talking if it's pretty big like that, make sure there's no broken bone, ligaments, then we try to, work on that, have the patient ice it. They might need to take some anti-inflammatories. We adjust them, we do the therapy, and we tape them. And sometimes you have to put them in a boot depending on how bad it is. So those are the type of things, that are pretty common. Tennis elbow, I take care of a lot of patients that play tennis. And actually, a lot of patients have tennis elbow and they don't play tennis because it's the brachioradialis muscle, and it's overuse of this. But a lot of times what happens is this little radius bone right here misaligns like that. There's a little ligament that holds it in place. When it misaligns like that, you have to push it back in. And sometimes they get trigger points in here, and you have to work these out. I've had patients that have had tennis elbow, and they've had cortisone shots. They wear a little brace like that, and those might help, but they don't fix the problem. We try to get to the bottom of the problem where the structure is involved and adjust it, maybe strap it, put some therapy on there, have them ice it at home, take some anti-inflammatories, but we also do the muscle work to help with that. So anyway, those are just some of the cases that we can take care of, the common sports injuries. If you have any questions, you can call our office, and I always do a consultation at no charge to see if you are a candidate. If you are from there, then we'll let you know. We'll examine you. If you've had any diagnostics done in other areas, you can bring those with, and we don't have to do those. And then maybe we can get to the bottom of it. I know that when patients are involved in a sport, and whether you're a young athlete or you're middle age, and you have to have something to look forward to, so you look forward to like volleyball or softball or hockey or flag football, whatever it is. Whenever you get an injury, it just kind of stinks because now you can't do it, and you have to have things that you look forward to so that it can help you handle stress. So it does get really frustrating. So if you have a problem and you're not getting the results you want, you might want to give us a call and just say you want to come in for a consult, see if maybe I can help you with your problem. So anyway, we had some technical difficulty. We couldn't get the Facebook Live to work today, so we just shot this video, and we're going to put it on there. So hopefully you enjoyed it. Also, if you know anybody who's having any of these sports injuries that we talked about, if you can like it, share it, we'd really appreciate it, because maybe you can change someone's life. So anyway, until next Tuesday, the Dr. B Show, if you have any questions you want us to cover, you can email us those, and I'll look forward to seeing you next Tuesday.